Hello, my name is Staff Sergeant Fender, and I want to thank you for taking the time to watch this short video on proper medication storage and accountability. In this video, we're going to discuss the following: unit policy letters and other federal guidelines that cover medication types, accountability, and security, the difference between controlled and uncontrolled medications, proper storage and security for controlled medications, forms required for inventory and accountability, and finally the procedure for handling medication from intake to disposal. Now I'd like to briefly go over policy letters. Policy letters may change from unit to unit, but here are just a few examples of policy letters that cover medication storage and security here in the 701st Military Police Battalion. 14th Military Police Brigade Policy Letter 11, 701st Military Police Battalion Policy Letter 9, and 701st Military Police Battalion Policy Letter 9 Enclosure 2, which covers scheduled medications. Now I'd like to talk about the difference between controlled and non-controlled medications. Controlled medication, in the most simplest terms, means that the unit controls the trainee's access to the medications. Policy letters and federal regulations help unit commands identify what type of medications need to be controlled. Some medications that are controlled are, but not limited to, narcotic medications and depressants such as muscle relaxers or anti-anxiety medications. Also, there are some situations where unit command can put a trainee's medication under unit control. For example, if the trainee is identified as high risk for self-harm or is under 24-hour observation. Now, non-controlled medication is medication that command deems safe and suitable for trainees to keep in their living quarters, where the unit does not need to control the trainee's access to these medications. Now, I'd like to go over some best practices for medication security and storage. First, medication should be stored in a secured container. A combination safe like this one is perfectly acceptable. The safe must be located in a secure room or office. If it's secured in an office, the person who the office belongs to must not have unaccompanied access to the safe. Prior to the commander granting access to medication storage, each person must have a background check completed. DA Form 7281, like this one, is an acceptable form to use for the background check. Once a background check for each cadre member is completed, an access roster in memorandum format must be completed and signed by the commander. In this section, we are going to discuss the forms that are involved with medication security and accountability. Here we have the company medication tracker for controlled medications and the company medication tracker for non-controlled medications. These trackers are just an overall snapshot of what medications are in the secure storage and what medications trainees have up in their living quarters. Next, we have the company medication log for controlled medication and for non-controlled medication. The medication log is used to keep accountability of each medication that is stored in the secured storage area. If a trainee's medication that was non-controlled, but command deemed that the medication should be placed under unit control, the medication log non-controlled form will be used to keep accountability of the medication until the medication is completed or the command deems the medication is no longer needed to be controlled by the unit. Here, we have the company medication inventory sheet. This is used to log when an inventory is completed. The CQ-NCO will fill out the CQ-on portion of this form. AIT platoon sergeants or daytime CQ-NCO on the weekends will fill out the CQ-off portion of this form. During any of these inventory, when one of the top three, whether it be the commander, first sergeant, or XO, conducts a joint inventory with the AIT platoon sergeant or CQ-NCO, they will fill out their information in the appropriate area. Other forms required for medication storage and security are the Standard Form 701 and 702. Standard Form 701 is Activity Security Checklist, which is used to log when a security check is conducted each day on each item in the security and storage of the medication. For example, the safe and the room the safe is located in. Standard Form 702 is the Security Container Check Sheet. This form is used to log when and who opened, closed, and checked the secured storage container. Next, I'd like to go more in depth with the medication log to ensure you have a good understanding on how this form will be filled out from when a trainee arrives with some new medication until the form is closed out. Here, we have a blank controlled medication log. When a soldier returns from the CTMC or the hospital with medication the command deems needs to be controlled, this medication log is started. First, the admin information is filled out. The admin information that is on the medication will be copied onto the medication log. Next, you are going to complete a joint inventory with the trainee. Once the joint inventory is completed, fill out the inventory information in this area. Each day, every medication in the secured storage container will be inventoried twice, once by the CQ-NCO and once by the AIT platoon sergeant or daytime CQ-NCO on the weekends. Also, one of the top three will conduct a joint inventory with either the AIT platoon sergeant or CQ-NCO. After each inventory, the inventory information will be filled out on this form. Also, when a trainee takes his medication, another joint inventory with the trainee will be conducted and filled out on this form. Once the trainee completes taking the medication, decides not to take the medication anymore, the medication expires, or the trainee leaves the company, at the bottom of the form is the final disposition for that medication, along with cadre signature and trainee signature. Final dispositions may be, but are not limited to, completed, expired, disposed of at the CTMC. Also, there is a note section for any information that may be important to list with this log sheet. If a medication goes from being non-controlled to controlled by command decision due to a trainee becoming high risk, a non-controlled medication log sheet will be started because this medication is not a normal controlled medication and is only being put under unit control due to the trainee being high risk. The non-controlled medication log sheet will be continued until the medication is completed, medication expires, or the command deems the medication no longer needs to be under unit control. Final disposition will reflect why the medication is no longer being controlled by the unit. If needed, the note sections can elaborate on the final disposition action. Here, we have a trainee returning to the company with new medication. The trainee alerts the on-duty NCO of their new medication. If it is during the week during duty hours, the NCO is an AIT platoon sergeant. During weekends and non-duty hours, it is the CQ-NCO. The on-duty NCO then opens the medication storage room. Notice how the NCO maintains a barrier between themselves and the trainee. This is to prevent the trainee from having access to other medications while the safe is open. The NCO then obtains the medication from the trainee. The NCO is identifying if the medication falls under the requirement of being controlled or if the medication is non-controlled. Brigade and battalion policy letters help identify controlled medications. The medication the soldier was prescribed is a controlled medication. The NCO then begins to fill out the information in the controlled medication tracker. Then starts a new medication log by filling out all the admin data found on the prescription bottle. After completing the admin portion of the medication log, the NCO and trainee conduct a joint inventory of the medication. Notice how the NCO is counting the medication in full view of the trainee. Once the joint inventory is completed, the NCO then returns the medication to its proper container. Once the medication is secured, he then logs the initial count of the medication into the admin section. All medication inside the secured medication storage area will be inventoried at least twice a day. Once by the daytime duty NCO, on the weekdays this is the AIT platoon sergeant, and on the weekends this is the daytime CQ NCO. Then once in the evening by the evening CQ NCO. During any one of these inventories, one of the top three can conduct a joint inventory. If one of the top three conducts a joint inventory, it must be filled out on a separate medication inventory log. One of the top three must conduct an inventory at least twice a month. Policy letters will dictate how often and when the top three should conduct their inventories. When a trainee would like access to their medication, they address their request to the on-duty NCO. The NCO will then escort the trainee to the medication storage area. The NCO will maintain the barrier between themselves and the trainee while they access the medication safe. The NCO and trainee will conduct a joint inventory of the medication. Then, the trainee will take the prescribed number of medication. Once the trainee is finished taking the medication, the NCO and trainee will conduct another joint inventory. After completing the second inventory, the NCO returns the medication to its proper container and returns it to the secured storage area. Then the information from the inventory, to include how many pills were taken and the final count of the medication, will be written in the medication log. The NCO and trainee will both sign the medication log, verifying all input information is correct. Upon final removal of the medication from the medication storage, the final disposition section will be filled out by the on-duty NCO. Again, reasons for final disposition can be, but are not limited to, medication is completed, trainee PCSs from the company, medication is disposed of at the CTMC. The trainee and NCO will then sign the appropriate blocks, and proper action will be taken to dispose of the prescription bottle and/or any remaining medication. The medication log will be kept for records, and the medication tracker will be updated to reflect the medication being removed from the medication storage. In this video, we discussed policy letters, regulations, differences between non-controlled and controlled medications, best practices for medication storage, and forms used in medication accountability and security. This concludes my video on medication storage and security. I hope this helps your unit maintain proper accountability and security of all controlled medications. Thank you.